Hello, my name is Jessica Papke. Thank you for taking the time to watch this informative video. In the next 5 minutes, you will learn the importance of fixing the roads in rural Honduras and how this can improve the population's health outcomes. This is a map of Central America. Honduras is the purple country in the center. And this is a close-up of Honduras. If you guys have ever gone on vacation in Roatan, Honduras, it is the island just off of the north coast. And in the center, you will notice Tegucigalpa. That is the capital city of Honduras. This is a map highlighting 3 cities in which Virginia Commonwealth University serves at their hospital in Honduras. Those cities are Coyoles, La Jicaca, and Lomitas. In a study, they asked the people living in these 3 cities what their biggest barriers to healthcare access were. This graph depicts those top 3 answers from that study from VCU. Notice how distance and availability were 2 of the top 3 answers. The city with the most problems, Lomitas, was the furthest away from the clinic. This picture is a beautiful representation of what rural Honduras is like. It's not a lot like rural Nebraska or rural Wyoming. Notice how it is very mountainous. Road conditions in rural Honduras vary. This picture was taken from my medical mission that I went on this last March. This is one of the larger cities in the rural area, La Esperanza. Notice that the streets are paved. However, this is a smaller town compared to the big cities that you will find in Honduras. In the more remote areas in rural Honduras, you'll find streets like this. Notice on the left-hand side how the street is completely dirt and how it is uphill. This is not an uncommon sight either. This road has been completely washed out by one of the rivers. Imagine having to drive through that. In Honduras, 6 in 10 people have cars. The rate of this is probably lower in rural areas though, because more people are living in poverty and they can't necessarily afford a car. That means that most people get around by hiking on trails like this. Imagine doing this if you were very sick, or if you had a lot of kids, or if you were pregnant. These hikes also take time away from when a person could be working or taking care of their family at home. Now the real question is, how do we fix this problem? How do we get people in rural Honduras better access to transportation? Millennium Challenge Corporation is an independent, bipartisan foreign aid agency that is leading the fight against global poverty. So far, they've donated over $10 billion in programs to support country development, including a project in Honduras. In order to increase farming access, MCC has paved 40 miles of secondary roads and 308 miles of main roads in rural Honduras. While this initiative has helped people with their access to farming in Honduras, this has also impacted people's ease to access of hospitals and health clinics by decreasing the cost to patients for both of those types of trips. I propose that the project that the MCC is already doing in Honduras be expanded to include more areas of rural Honduras in order to increase people's access to well-paved roads and transportation. Because many people in this area do not have cars, I propose a bus system be put in place. The buses can travel to the remote areas however often they deem fit for their population demands. These buses would go between the town centers in remote areas and the clinics or hospitals. As Honduras is currently expanding their bus system as we speak, the cost to maintain these routes can be factored into their budget and be a part of this bus expansion. Not only will better transportation system help the people in these rural areas reach health clinics and hospitals, it will also give them better access to grocery stores so they can have better nutrients, as well as to some cultural festivals in larger towns which can be good for one's spiritual well-being. A treatment center may have the best care around, but if those patients cannot access that center, then it is no use to them. By creating better transportation systems in rural Honduras, the people there can have access to better health care and a better life.